Thank you, Dr. Barron.
You're welcome.
Great to see some familiar faces. Thank you for coming, and welcome to the office, I should say. So yes, Dr. Barron did a wonderful job explaining the new definition that we have for dry eyes, and a lot of focus in recent history. When you go to conferences or continuing education lectures, it's all about the meibomian glands, this rancid oil that's stuck deep inside there, and the bacteria and those mites that we call Demodex, and their level of contributing to the inflammatory pathway in dry eyes was the main focus. But as Dr. Barron was also talking about, the tear film and its imbalance, well, what is it imbalanced with? If not just oil is important, but the water component of our tears are important, and the mucus layer of our tears are important. I like to think of it like a house. You have the roof, that's the oil layer. If you don't have your roof, everything kind of just evaporates. That water layer is just going to evaporate into the air, and you're going to experience dry eyes. We call that evaporative dry eye. That's the main driving mechanism in MGD, the meibomian gland dysfunction. But what about the aqueous layer, the water layer, and the mucus layer? The mucus comes from what we call goblet cells that live on the tissue that's right on top of the white part of our eyes, or the pink region if you pull down your eyelids. That's the conjunctiva. There are different names depending on where the conjunctiva is located, but it might sound familiar to you if you've had a case of conjunctivitis, inflammation of the conjunctiva. In any case, that's where those cells live, the mucus-producing cells. So we have the roof of our house, the oil glands that live in our eyelids on the deep down inside on the surface. We have the mucus-producing cells. I like to think of those as the foundation of the house, keeping everything together, and the water comes in as everything that's in the house. So we have everything in working order, a nice big house ideally that's comfortable to live in. You have a place to sleep, a kitchen to cook your food. But it all doesn't matter. If you don't have a roof, you can't live in it. If you don't have a bedroom, you can't sleep in your house. If you don't have the foundation, it all crashes. IPL is excellent at reducing the inflammation that may shake a little bit of the foundation. Radio frequency is excellent at contributing to the relief of your roof repair, for example. And the JETT plasma pen is extremely unique because it'll treat all three. And we'll kind of get into that. Non-invasive, no needles, just a numbing drop for comfort. That's all you really need. It's very gentle. We do all kinds of treatments here. We like to tailor it to the individual. So some of you I see out in the audience, you're doing one treatment and some of you are doing another one. That doesn't mean that JETT is right for everybody. It's right for many people. But if something's working that's more of an in-office advanced treatment, we kind of like to stay where we are, but we can maybe elevate your treatment depending on what else may be going on. So the JETT plasma is great for the all-rounder kind of person, which is, the majority of people. It'll stimulate healing. It'll stimulate the oil glands. It'll stimulate the glands that secrete the water, and it'll stimulate the glands that secrete the mucus. So all three layers. And that's where we get that homeostasis from. Radio frequency, IPL, fantastic. And sometimes we combine everything together. We kind of throw the book at you. And we hope for the best sometimes, but dry eyes can be really fickle, as some of you know, or may be experiencing. And it's about management. None of these things are curative, but they help reduce the symptoms, get you back to your normal life so you're not thinking about it as much. We really want to push this down to the bottom of your to-do list. I'm sure you're all busy with other things that you need to be doing other than worrying about your eyes. So we already spoke, it relieves your dry eye symptoms and kills the bacteria and kills Demodex. That's kind of the cute picture that we found of the Demodex mites. Look at them with their long eyelashes there. There's actually two forms of them. There's Demodex folliculorum and Demodex brevis. The Demodex folliculorum lives in your hair follicles, right by your eyelashes, swarms. Everybody has it. It's when you have too much, it causes inflammation, will inflame the meibomian gland especially. When they dig themselves deep into that meibomian gland, which I kind of have a picture of here, you can kind of think about here, it'll dig its way. I wish I had a laser pointer, but maybe I have my mouse here. Never mind, I don't. This is just one long gland that lives in your eyelid. And the Demodex mites like to live in these little sacs that secrete the oil. Those are called the acini sacs. and that's called Demodex brevis. So there's really two forms. IPL will kill the folliculorum, radiofrequency won't kill any of them, and jet plasma will kill both varieties. All of these contribute to inflammation of that whole area. It's great to get out the rancid oil that's in there, but why is there rancid oil in there to begin with? It's the inflammation, the tight blood vessels, those what we call telangiectatic vessels that aren't supposed to be there. They start to grow and constrict that gland. The bacteria that's in there causes the inflammation. The Demodex that's in there causes the inflammation. That all raises the melting point of that oil, because it should sit at normal body temperature and melt and get excreted onto your eyelid on the ocular surface every time you blink, but it doesn't because the melting point's too high. So then we like to use techniques like radio frequency to melt it, but this is different. It doesn't use heat. It uses something else called electroinduction, a really fancy way of saying we're going to apply an electric field to this. We're going to electrocute your eyeballs. Not really, but a small electric field on there. Why is this important? Our cell membranes, like our skin, have pores. Those pores act like channels and they open and they close. If you imagine an inflamed cell is flat like a pancake, it's lacking its water, it's lacking its nutrients, and we want to blow up that beach ball. I like a beach ball analogy. A deflated beach ball is no fun to play with, so you pump it back up with air. And that's exactly what this electric field is doing. Without getting too much into the science of it all, it causes a reaction called reversible electroporation, which is a really fancy way of just saying it opens up those pores. That means water can get back in, nutrients can get back in, and we often use medications to drive those medications back into the cell to get an enhanced anti-inflammatory or antimicrobial effect. That means it's killing Demodex and it's killing bacteria much more effectively. And we also have some early evidence that it kills viruses, but we can't really say that on paper quite yet. But it could probably kill viruses. In any case, I have a nice example here. This top eyelid, it might be difficult to see, but around the eyelashes is like these dandruff-like flakes. That's blepharitis and Demodex. This patient of mine, clean eyelids now, that's about 3 weeks after treatment. She would come to me for an in-office treatment, not one of these. It's called blepharoexfoliation. It just means we're going to exfoliate your eyelids. Just clean off all this nonsense that's on there, all this, the crud that's built up. And we probably need to do that every 6 months, but it's pretty good, very easy to do, pain-free. She was in my chair every 3 weeks. It wasn't lasting 6 months. So we decided to do jet plasma treatment on her, go across the lid margin. We treat both that conjunctiva to get at the goblet cells that secrete the mucus. We treat at that lid margin as well to kill the bacteria, the Demodex, and get at the oil layer. Another thing I should mention is what secretes water. There's 2 areas that secrete water because we're treating that as well. One comes from the lacrimal gland that lives behind your eyebrow, and the other comes from small little accessory glands that also live on the conjunctiva. So when we're treating the conjunctival tissue with the jet plasma pen, that's how we're able to treat everything simultaneously. In any case, she underwent that treatment, and I used a medication as my gel glide. So you can see on my picture here in purple, that's a gel. So when we do this, we lay down a gel on the tissue and our pen kind of glides over top of it. With this patient, we used a antibiotic and steroid combination because we know there's inflammation, so steroid really attacks inflammation nicely. And we know blepharitis is caused by staph bacteria that lives on our skin, so it will really work nicely with that antibacterial and steroid effect for the anti-inflammation. And this is 3 weeks later, but I can tell you I've also seen her 6 months later, and she's perfect. I see her once a year we do a treatment. Generally, we recommend every 6 months, and we were kind of on that track, but she calls me at the 6 month point and says, hey, cancel my appointment. I'm doing really well. Or maybe come on in, can Dr. Freeman, can you please just check my eyes? Tell me you don't see any of those fluffs around my eyelids. I'm more than happy to, and there's no fluffs there. There's none of that dandruff. It's all gone. She responded really well. Everybody's a little bit different. It's really a fickle beast. It can be very difficult to treat. Some people, it depends on your stage of disease, what else is going on. Like Dr. Barron explained, it's multifactorial. I can't control your hormones. I can't control your medication use. I can't control the environment that you're in, but we can mitigate all those factors and their effects on the eye. This is a little diagram. I was kind of debating whether or not I would show this, but our pupil, a colored part of the eye here, all these little dots, those are the goblet cell locations on our eye. There's hundreds of them everywhere, all over. And when we're doing the dry eye treatment with the JETT plasma, we're getting to all of these zones, secreting that mucus, getting the oils ready and prepared to be excreted onto our ocular surface. These larger dots are our accessory water glands. They have names, we don't have to go into it, but we're able to treat those by just flipping up the eyelid. As some of you, I noticed that do this treatment that are here tonight, you'll recognize that we obviously, we flip the eyelid and treat the conjunctiva underneath there, and we'll pull down and treat down here as well. Again, no pain, no needles, nothing. It's just weird to have your eyelids flipped, and that's just the sensation. But you're not here for the spa treatment, you're here to, get some work done. This is a patient who has undergone the full treatment as well on this side here. You can see how red and inflamed she is at top. After about the third treatment, we don't really see much inflammation anymore. This was also using the same combination of a steroid and antibiotic to treat that patient. Over here, I'm sure you've all had styes before. Raise your hand if you had a stye, or sometimes we call it chalazions. Boom, right there, yeah. This is her. That's Nicole. Day one, it hurt. It hurt to touch. They're inflammatory and they're infected. You touch on it, it's like, oh, that's painful. It's like a bruise on the eye, on the eyelid. So we said, all right, let's do this. So I took the pen right to that area. It's only 3 millimeters in diameter, perfect size for these things, but not sharp because it's flat, and 3 millimeters in diameter is quite big enough for this kind of thing. And that's just after one treatment. It was about a week later. So we're really able to kill the bacteria, reduce that inflammation, and get the patients on their merry way. And if you're lucky enough, you'll get an aesthetic benefit too, because it'll stimulate collagen and elastin. That electric field can be applied to anywhere. And I think we'll have Oiku kind of talk more about that as well.